Is my network still unstable? Then I had to switch.
Okay, I'm gonna mute it on YouTube so that it doesn't echo. Let me see. Right, Linda. Very good.
Yes, good evening. My name is Linda Gray. I'm the Diversity Outreach Coordinator for the ANWEP Texas COVID-19 project. I want to welcome you to another community conversations about the COVID-19 vaccines. These vaccines have shown to be highly effective at preventing and mitigating severe disease from COVID-19. ANWEP, through our project community leaders across the state, has created a very good culturally safe space for African-American immigrants and also African-Americans and communities of color to connect, network, and have their questions about the COVID-19 vaccines answered without the fear of social stigma, which is a major deterrent for not taking the vaccines. This presentation will be highly and very informative and effective in educating all of us about the COVID-19 vaccines. Before I transfer the mic over, I want to talk about just briefly our webinar etiquette. Please be mindful of your mic. Be sure that your mic is shut unless you are speaking, and also be mindful of our great guest speaker that we'll have this afternoon in order to give him great opportunity to give us the presentation and then us the opportunity to ask questions. During his presentation, would you kindly do your questions on Q&A? That way, we'll be mindful of the time, and then we would be able to get through all of the Q&A. So without further ado, I am so happy to present our project lead director, Ogechi. Ogechi.
Thank you so much, Linda. I've been battling a cold, so I'm trying to clear my throat. Thank you for that very warm introduction, and good evening, everyone. I want to welcome you to our monthly community conversation around the COVID-19 vaccines outreach and education project that ANWEP is currently working on. One of the many tragedies of COVID-19 pandemic has been its disproportionate effect on minority and immigrant communities. ANWEP is working to ensure greater access and knowledge of COVID-19 vaccines through education and outreach to populations disproportionately affected by COVID-19, with the goal of increasing the number of people fully vaccinated for COVID-19 vaccines in Texas. Today's community conversation topic is building a healthier, stronger, and prosperous community beyond the COVID pandemic. Let us seize the opportunity in the crisis. Our guest speaker is Dr. Eric Ohene. Dr. Bright Eric Ohene is a Ghanaian cardiovascular surgeon, an invasive cardiologist, biomedical scientist, entrepreneur, and motivational speaker. Dr. Ohene is a consultant and affiliate research professor at Northeastern University Department of Bioengineering where he plays a critical role in building a biotechnology and biomedical industry in sub-Saharan Africa in order to improve healthcare delivery, regional infrastructure development, and human resource development. He's a global health advocate, physician scientist with expertise in international medicine and public health. Over his career, he has served on several committees, ranging from grassroots community organizing to consulting for diplomatic missions, diaspora communities, and as an independent observer of the 72nd World Health Organization. Since the peak of the COVID pandemic, he served as a volunteer physician scientist for the Massachusetts Medical Research Reserve Corps, MRC. Dr. Ohene also started and led the COVID-19 vaccines education, equity, and access initiative aimed at helping deprived immigrant communities and communities to work with the MRC faith-based organizations. Dr. Ohene consults for the TIS Foundation, Washington, DC-based organization, our Hope Africa Foundation in Ghana, to design, plan, and implement post-COVID community rehabilitation programs that address pre-existing community conditions that make dwellers more vulnerable. He is currently the first African representative member of the board of directors for the Asian Society of Cardiology, committee member for high-level health projects for the Belts and Road Initiative, CEO of 4957 Limited, and co-founder of a new Pan-African organization, the Alliance for Total Freedom for Republics and Independent Countries of Africa Network, African. African is the acronym for that. Dr. Ohene believes that the restoration of the humane treatment we so desire depends on a better, stronger, and more powerful Africa. We will continue to suffer and wallow in blame gaming if we do not connect our individual dreams and aspirations, create a functional and united front, and lay aside our individual historical experiences, religious awakenings, socioeconomic status, and geo-cultural identities. Wow, what a very packed and powerful, solid bio. And without much ado, I want to go ahead and welcome Dr. Ohene to take us through the topic of discussion today. And at the end of the presentation, everyone would have the opportunity to ask questions and to contribute to the discussion. Dr. Ohene. We can't hear you, you're muted.
Okay, so I'll mute myself. Are you able to hear me clearly?
We can hear you clearly, yes. Yes.
Okay. My internet is a little bit hitchy, but I hope that you pardon me, and I hope that at the end of the day we're able to exchange ideas. You need to know that this talk is not going to be an expert coming to throw around statistics and have any big medical talk. That is not the purpose for these very meeting. My purpose and goal here is to how I can help my brothers, my sisters, my mothers, my aunties, my grandmothers, and actually patriotic people who are within the community. I may not meet any of you directly, but I do know that all of you, your presence in the United States makes it very easy for me to also be here and then be acknowledged as an African. A lot of people have gone through a lot in America, and you've paved the way, and I'm very happy to be part of this very platform and to share the little I know and sort of provoke you. My goal is to make you angry. my goal is to provoke you to be able to come out from within yourself and begin to extend far beyond yourself, because you can only be as big as the dream you have as an individual. But imagine your dream connected to the dream of other people. So that's how we look at it. I personally, even though I do like clinical talk, and then I'm a surgeon, and then everything that I do, it's all about cutting something and joining something. It's whichever way you look at it, there is always an incision done in our interaction. We either use words to make an incision. I can speak and you'll be healed. I can speak and you could be hurt. I may not necessarily use a scalpel to be able to make an intervention. So I personally love the idea that we can use this sort of platform to be able to interact and share ideas. What I know, I share it with you. And I do hope that this is not going to be a one-way affair, but it's going to be a platform where we exchange ideas. You teach me and I share the little I know with you. I'm very, very happy, Ms. Ogeji, for the opportunity to be invited to this platform. Ms. Gray, I'm very happy to be part of your to be part of this very movement. We say that where women are gathered, that's where power is. And so I'm very happy to be part of this very huge organization. I was raised by my great-grandmother. My great-grandmother was quite old, and when she passed on, I had to live with my grandmother in a tiny fishing community in Ghana. And it's been very wonderful. I'm just saying that to say that I was raised by women. I know how powerful women are. And so when women come together and they say they want to build a community, means they actually know what it means to build a community. When women want to build a community, they are not building a community to dominate somebody, but they are building a community that has a future, survival. So they are interested in the safety of a community they want to build. When men build communities, they are interested in building fortresses and go and conquer more spaces. But all I believe in is we first of all must put our house in order to be able to understand what it means to have a value and a roof over our head. But you can have the best roof, but if you don't have safety within that very space, it won't take us anywhere. The world has been a very wonderful place, and there is a safety within the world. Our activities as human beings has caused lots of distraction to the world we live in. Much more so the world in which we live. There are two worlds. The world which we live in, which is external world, and the world that is living inside of us as persons. Our lifestyle, our behavior, and the things we do cause more harm to that very healthy, innocent bodies that we actually inherited from our parents and the good genes we got from them. And also our activity externally also cause a lot of damage. So you find out in we humans, in our quest to understand problems and solve problems, we create lots of problems in the process. And I can say that I'm not here to come and tell you the origin of COVID-19 or the extent to which the damage that it has caused, but we must not continue to trumpet the problems created by COVID, but we'll try to find out solutions that actually, through COVID, we are able to actually, through COVID, what have we learned? And what can we do to be able to put ourselves in a position secure enough to be able to confront whatever challenge we may face together as a group, as a people, as a tribe, as a family, and as a unit moving forward. And so that's what basically I want to talk about. We all know that from 2019, a lot of us are stuck. The number that I believe all of us may never forget in our life moving forward is the number 19. And it's because even though we are in 2023, we're still thinking about COVID-19, and we are here moving forward, but a lot of us we've lost a lot of things. We've lost a lot of things. We're stuck behind. There are a lot of plans that we were denying. A lot of people's lives have been denied them, and a lot of things happen. Economic plans. A lot of us are not able to connect with people we need to connect to, and human actually need connection to be able to form strong bonds and actually create meaningful society. And we do know COVID has really denied us, has taken a lot from us we cannot replace, but at the same time, it also exposes us to what problems that are there. And I'm still saying the same thing in a different way. Pardon me if you feel that I'm beating too much about the bush, but we do know at this point, we know that COVID, wherever it comes from, it has the ability to take lives, and it has taken many of them. That's number one, we learned that. Number two, we've also found out that we cannot see this virus. We cannot see it. So if this were 200, 300 years ago, a primitive person would say, the gods of the unseen world has visited us as a plague. We do not know what happened in Egypt, but I am a Christian. I have a very strong biblical background. And so I do understand that back in the days of Moses, there are people called children of Israel, and which I believe we all have, we have this kind of identity. They were in a country, and that country, there was plague that came there. Whichever means the plague came, we're not sure. But a lot of people actually perished in that process. We find ourselves again at a world global center, just like Egypt was, a place where everyone will go for food. There was hunger in the world, and everybody want to go there to get some food. Here we are again, and we have this kind of plague, and has taken many lives. And it looks like the solution will be to escape. And it looks like the solution that those people had in their time was to live in a place called Goshen. But Goshen is an idea. It's an idea or a society created by people like you. So this space created by these the Nigerian entrepreneur women organization, we can consider that as a sort of a Goshen. What is Goshen? Well, when there's darkness all around, but the city of Goshen do not experience darkness. There is sickness all out there, but the people of Goshen do not experience that. There were a lot of people who could not connect. There was hunger out there, but there was no hunger in Goshen. So it just means there were intelligent people, or people who thought about togetherness and came together and find meaningful solution to problem that will probably affect other people, and it will not affect them. But what is the story today for our community? People of African descent across the globe, we happen to be at the bottom of a lot of the socio-economic ladder. We suffer lots of things, but in the past, they lived in Goshen and they were able to do lots of wonderful things. And I think it's not late. Just a group of people came together, create meaningful society, regardless of whether they belong to the tribe of Benjamin, belong to whichever tribe, they came together. And that togetherness was what made them survive together as a group. So I think that this is a beginning of a nucleus or a seed moving forward where we can create a very meaningful society. Now, what conditions do we have as a people that made us disproportionately suffer from the consequence of this COVID-19? This is what I would like us to have a discussion about. We know many people. I don't want to waste your time. If you go online today and say, how many people die of COVID? Millions have died. How many cases across the globe? All of them are there. And so wherever you go, the numbers are hitting us in the face. How many people here on this very platform listening directly via Zoom or probably on the internet? A lot of people probably might have known somebody or known somebody who probably lost their lives or got sick or got infected with COVID. I myself, working on the front line, I got infected by COVID at least 4 times. And even during the COVID, I traveled in and out of the United States trying to find out what programs are they implementing here that we probably would need to have in Africa. So I've really moved a lot around. And what was my goal? When a lot of people were running away from COVID, I got myself stuck here. You know, I came to Harvard University to come and do a program because I'm interested in pooling resources to do some things in Africa. When COVID started, everything shifted online and I couldn't go anywhere. I was stuck here. I couldn't go back to Ghana. I couldn't work. I could do nothing. I wasn't licensed at that point. And so I was just stuck. My life came to a standstill. Then they said, okay, there was a vaccine rollout. They need physicians to the front line to work. And I said, okay, let me just go and learn what is going on. And then so I had the first-hand experience to go and then see for myself what is going on out there. And so I jumped into that very storm. And the eye of that very storm or tornado of COVID, I've seen it. I've seen what happened when the vaccines were rolled out. I also could see firsthand that even if the vaccine had something good to offer, it's very likely the people that looks like me, they may not benefit because a lot of them were not there. Because I can say for a fact that out of 100 people that will come there, you have at least less than 3 persons that looks like me. And I was right there in the front. So I can say that, okay, there is nothing I can write home about how it is affecting the people or a people group that I belong to. You know, America, whether we like it or not, there is a class, there's a grouping. People are grouped together. There is Latino, there is Caucasians, there is Africans, there are Blacks. And so there's this grouping. So everything that is done, we may think of ourselves as Nigerians, think of ourselves as Ghanaians, Caribbeans, Americans, but now it looks like you see a name like Black, and that Black actually now you don't have a border definition to that. Whether or not you came from Africa yesterday or you were here, unfortunately, through whichever means you got here, 100 years, your descendant, but you still belong to that very group. And so they've lumped us together. So how can we together begin to leverage on that very togetherness and make a case? Because in my village, they said one broomstick is easily breakable, but when you put a broom that is tied together, it's difficult. It's just to say, united we stand, but divided we fall, kind of a thing. So I found out that firsthand, there were less people who look like me having access to COVID-19, access to COVID-19 vaccines. So what do I need to do? We need to know there is always an inherent bias that will exist in any system that will put some group of people in disproportionate position. We need to accept that. We need to come to the point to accept that there are inherent biases that exist in any working model. That's why there is no working model that is 100% sensitive and 100% specific. So when you study science or statistics, there is what we call sensitivity and specificity. So when something is so perfect, is sensitive 100%, it cannot also be specific at the same time or 100%. So even a perfect system, as we may actually think of it, will have inherent biases. If you tell me that the group of people who lived in a particular environment are less than a particular age group, let's say less than 50 years old, but that is the group, the highest age, let's say that the maximum age in that group or the model age in that group is 50 years, and you roll out a program that actually factors people who are 65 and above, then definitely if that particular group do not benefit, it's because there is already a restriction. So it may not sound like a direct restriction, but it is also a restriction. So it may not necessarily be it may not be a necessarily hesitancy, but there could be an inherent bias that is in a criteria that is created that would make it impossible for some group of people to benefit. Because for instance, let's say, for instance, in America, we have a very high population of people from Africa coming in, and most of them, they come and work very hard. When they grow older, they came to labor their youth here. When they are old, they go to Africa. Their goal is, I'm going home to die. If I will die, I don't want to die here, so they'll go home to die. So an average life expectancy, as they call for Africans, is somewhere around 65 and 70. And average age on the continent of Africa at the moment is 60. No, the highest age, the maximum age in Africa now, the average is around 62.5. And the average age on the continent is about 19.8, means our population is youth. But the oldest population, or let me actually rephrase it. My English is quite a little bit porous. Let me just rephrase what I just said. Average age on the African continent or within the Black people around the globe, let's say it's around 19.8, okay? But on the African continent, the percentage of the population that is above the age of 62 is less than 4% of the population. That tells you these are young people. So if you set up a criteria that for a particular group of people, they would only benefit if they are above a particular age, and you directly ruling them out. So I am trying to tell you that there are a lot of things that were done not having all people in mind. Even if they have all people in mind, there will be specific group of people that will benefit more, or specific age group that will benefit more. So from the start off, we have factors that actually disproportionately put us out of the bracket of benefiting from the start point. So we need to know that why do we have, the hesitancy is not just a statistics, it's a product of one, inherent biases and historical problems that existed. So vaccines has been there. If you've been to Africa, you find that some people have tribal marks on their faces, or they have some cuts. This is our traditional vaccination and inoculation program. Many years ago, we've been doing it. In America, especially New England here, the first vaccination or immunization program that started and saved the city of Boston was brought here by one a slave named Onesimus. Onesimus is a West African slave who was at the port and heard there was a disease, there was an outbreak in the city, and people were dying. So he came into the city and then said, oh, he knows he has a solution. They've had a treatment for it in West Africa. So he came in here and then helped the city and taught a medical doctor. That medical doctor is called Boylston. So when you come to Boston area, there is a street, several streets or bus stops called Boylston Street or Boylston Station at downtown Boston. So I want to say that we've been involved in medicine and there's a lot of historical evidence. But what is happening right now, I don't want to go into that historical. So I'm saying that whether we think it is safe or not safe, we've already been involved in, we've been involved in the progress of medicine in this frontier. I'm not convincing people to go get vaccines. Neither am I dissuading people from not taking vaccines. I want people to be healthy. I want people to make a decision that protect them and protect people around them. So now I will not talk about vaccines. I will talk about what are the problems that existed within our community that made us vulnerable, and how can we address those problems so that we are in position not to suffer the consequence of whatever will come in the future. That is what we mean by building a stronger community, a stronger and wealthier and prosperous community. So I would want to start from us as individuals. We find out our lifestyle, whether we like it or not. I may say this, and forgive me if you do not agree with me, but I consider myself an ectopic person. When I say ectopic, I'm sure all of you understand. Ectopic is just something growing somewhere, that something that is somewhere it ought not to be at a particular time point. All right. What I'm saying is our women will understand that better because they've gone through the process of childbirth. And God bless you, our mothers and our sisters, for that sacrifice. And I'm saying that sometimes the implantation do not occur where it ought to. Then the baby is growing somewhere else and it's very dangerous. So it threatens the survival of that child. So what it means is I was born in Ghana, I'm a Ghanaian, and the people all in that environment looks like me. I find myself in an environment where the weather conditions is different, the food that is growing there is different, everything is different, healthcare system is different. There is the traditional values, the things, environment is different. And we are like trees. A tree is moved from one environment to the other. Apples grow in temperate region, but they may not grow probably in my village because the environment does not. And we are trees as well. So as we find ourselves in a different diaspora space that has temperate conditions, the food we are eating, our lifestyle has changed. We used to walk miles. We used to sweat a lot. We used to be under the sun. Now we live a lot of sedentary life. Whatever that consequence comes, we do know so we are ectopic, as it were. We find ourselves in a different environment, and that environment predisposes us to certain lifestyle that otherwise we wouldn't have faced. That means we would have walked instead of driving. Maybe we would have actually rolled down the glass with our hand instead of pressing a button for the glass to calm down. All right. Or maybe we would have been under the sun and get enough vitamin D so that whilst we are here, we don't get those. So you can see that these are some of the pre-existing conditions that we had physiologically speaking. So I'm saying that the problems, most of them are intrinsic and extrinsic. That means they are from within and also from without. So within problems will be you as an individual. Who are you? Where do you find yourself? Where were you? What conditions change? If you put a tilapia in a marine environment, it's not going to survive because the salinity, the salt concentration is different. So all these things are different. So this is all I'm trying to say, that as we find ourselves in this kind of environment, things are good. But how many of us can agree that when we were leaving the shores of Africa, or when we've at a point in our lives, what was our body weight? Did we see that, life becomes good and our body weight has increased? Obesity. And does that predispose us to other conditions? I can talk about a lot of these physiology and things, but I just feel that we already know what we are doing right. We know how we feel, and how we used to feel. And the difference is one thing. You are in a different environment. You are eating different things. You are living a different lifestyle. And so most of the conditions that, that is related to COVID, which they call pre-existing conditions, most of them are lifestyle related. All right. But even though we say pre-existing condition, like I said, we are classifying them in two. The ones that are localized and related to you as an individual, and the ones that are occurring that is beyond your control. Just as we say, there is two types of freedom. We have positive freedom and negative freedom. Freedom from and freedom to. Freedom from is you are free from the fact that you do not have access to. You cannot say there is no vaccine. But the freedom to is if you are in a condition where you cannot take the vaccine, then it's an inherent limitation placed on you and you cannot do. So there is that very aspect where you have the extrinsic factors available for you to do something, but inherently you do not want to do that. So that's one pre-existing condition. The other pre-existing condition will be your personal beliefs. All right, your personal pre-existing, your condition, your belief, your faith, your ideas, how you understand, you interpret the freedom to choose, freedom over your body. That one is personal. But there are some other aspects where the freedom from and freedom to, which is extrinsic component, which also fall under the pre-existing condition. I'm going to explain that. And that is where we now begin to talk about opportunities that we need to leverage on. I'm trying to create, I don't know if you get what I'm saying, but, I'm not a very good communicator. My scalpel do more talking, but I hope that you are able, I'm talking as though I'm just talking to my grandmother, my aunt, my sister, and I'm not trying to have a very, this is not thesis. I'm not presenting a thesis. So I want you to forgive me if you are not really liking the way I am presenting it, but just so you know that I really like what I am doing right now, and I'm happy to be sharing what I feel with you. And the whole idea here today is for you to ask me questions if it is medical. That one, you can do that anytime. My contact is going to be available. And I'm going to put you in a frame of mind where you begin to ask questions that actually takes care of pre-existing conditions that a doctor cannot take care of. Because most of the problems we have with the pre-existing conditions, they are mostly not inherent. They are not related to us as individuals only. They are a product of a system that already has inherent bias that we need to know. How can we leverage on, how can we make a case to take care of our inherent challenges that we face, which is related to COVID. So now the next principle is, we know COVID kills, we know it's taking lives, we know when you have some conditions, it makes them worse. And if you have some conditions, COVID is actually going to make sure that it also will create another future disease for you. Because if you do not have a heart disease and you take COVID vaccines and all, you get COVID infection, there are challenges, because if something was not part of your body and you incorporate it into your body, definitely there's going to be some reaction. These reactions can be well controlled, or some of the reactions may not be well controlled. Some of these reactions may be immediate. Some of these reactions may be slow, gradual releasing, and long-lasting consequences. So both the COVID virus and the vaccine definitely will alter your physiology some way, somehow. And I'll stand to defend myself wherever I'm called to talk about this, because I do know whether you feel you become stronger after taking it or not, that's still a kind of modification that occurred within you. Whether your reaction is so strong that it attacks your own self in the process, that is still a kind of reaction. So those ones, there is already agreement out there. Somebody can have an acute hyperreaction after taking vaccine. And we know that it is well established. Honestly, in the hypothetical absence of vaccine, someone may not have died. That's why we have attributable causes of death due to something. So we will not have that argument. Anybody who want to have that debate can actually come, but that is not what we're doing today. All right. So there is that adverse outcome related to both having gotten the infection and getting vaccines. And there is also that very benefit. Generally, when we talk about public health, we're just talking about the fact that, okay, the number of people that would be sacrificed as against the number of people that will be preserved, you put it on a scale. And on that very liberal scale, we want to say there's more benefit. You may be an unfortunate person that may suffer, but it still doesn't mean the intervention will not go on. I am speaking to you like my mother, like my aunt, like my sister, and I hope you understand that. But that being said, I still recommend that everybody, if you within you to go get your vaccines, please go get. I've gotten all my vaccines. I'm an advocate for the vaccine, but I'm just trying to say in that is around the virus, okay? So now we'll talk about factors or comorbidities related to, or factors or comorbidities that exist within our community. All right. What are some of the factors that affect us disproportionately? Number one, we already addressed the health aspect. We know that already. But now let me ask you, if you're originally from Africa, or you are originally from a country and you come to another country, then you cross oceans, you move from one jurisdiction to the other. There's a different law that operates there. This is probably immigration. So one of the reasons why we disproportionately suffer from the consequence or the adverse outcome of COVID pandemic is because of immigration. There were issues related to immigration, for which, how does the immigration actually comes in here? If you feel that you're not in your immigration status is not right, would you actually access healthcare? You don't have the right. Maybe you may benefit from emergency care and things, little emergency care. But number one, let's say in the hypothetical absence of COVID, you have chronic condition that you need to go see the doctor for, and you feel that you don't have health insurance. And as a result of your immigration status, you cannot go to the hospital. That condition is going to worsen. And when COVID comes in, you're on a back foot. So definitely immigration is one of the factors. This is one of the pre-existing conditions within our community. Immigration is very important. Therefore, when we are implementing and try to initiate or start initiatives that address our community problem, immigration must be part of it. And COVID is the opportunity, the best opportunity we have to be able to address that immigration issues. Because COVID now has taken the lead of the fact that we are suffering from a consequence of a particular condition that we did not create. And whilst you are in a different person's land and something bad happened, it is actually, legally speaking, if I come under your roof, and I am there, and you couldn't protect me if something bad happened to me, definitely looks like that's the reason why if you go to a facility, they will ask you, okay, do you have an appointment? Do you have all that? So that means, technically speaking, the land and then the system here has some kind of responsibility by the fact that a condition was created as a result of they not being able to protect the disease from coming in, and it affected you. So if you actually have evidence of having had COVID on some occasions, and you have your vaccines, yet you have had COVID again, definitely you have a case to be able to talk to a healthcare professional to be able to position you on a path where you can take care of your immigration issues. So if you need to benefit from health as a result of immigration, that can be taken out of the way, and you can still live a very healthy and meaningful life as you want to. So that is the aspect, one of the aspects. So this is one of the things. So whether or not some people were here hundreds of years ago and some people came yesterday, the issue of immigration still affects all of us. Even though we may not know superficially, we may think we are different. But when you go deep into the law, you find out that we all are treated somehow the same. Honestly speaking. So the earlier we come together to bury, that's what I mean, that's what I meant by saying the earlier we forget about our historical experience and geopolitical identity, the better. Because within even we who look alike, there's a lot of division among us. We think of ourselves as Nigerian, Ghanaian, Ethiopian, but for us, we are all aliens. All right, so the earlier we come together to create a meaningful society, the better for us. So I am very happy, and I'm very glad that there is this very organization, group of people. Maybe 20 years ago, there was no such thing as, Association of Nigerian Women Entrepreneurs. There was nothing like that. So we are actually moving in the right direction to be able to address the needs, listen to people, and put them in that kind of space. And so I'm very glad that we have a lot of these meaningful organizations come together. So ANWEP is a step in the right direction. The next step would be to understand what the immigration policies say regarding individuals in this kind of circumstance. How can they benefit? Probably because if somebody comes in and his immigration status is not correct, and he has children, his child is considered unauthorized individual. And unauthorized individual, what are the problems there? There are a lot of people who were born here, been here for like 10, maybe a decade or 20, or maybe 2 decades. And so what did the law say regarding such a person? We are not very much informed. And even those who are informed, we are not together. So we are not able to share ideas among ourselves. That's why I'm going to just provoke you a little bit. Then we'll begin to see, don't look at the hand when you are holding it. Just hold on to a hand. We all are in this ocean and we're drowning anyway. So let's see how we can actually move forward. So immigration is one. And then if your immigration status is actually an issue, now we've come to employment. Unemployment or employment. We are pushed to the point where we don't have a choice than to take certain jobs or certain works that actually we are in non-negotiable condition. We don't have an excuse. And some of us, we know that what we are doing, it's reducing us, we are suffering, yet we feel we are helpless and we are in a state where we cannot do anything. So we continue to suffer. And we go and get these conditions, we go and get these from our workplace. We take care of elderly people. I think most of the work of even the compassion and the heart to take care of the sick, the needy, is done by most people who look like us. And when those people get whatever condition they have, we get it from them because we relate to them, we clean them, we do everything, we wipe them, we do everything. And because we find ourselves in a situation where we felt we are helpless, non-negotiable, Once we are able to put something on the table for our family and help our people back home, we feel we are there to be the sacrificial lamb. And, so some of these things is the reason why. And so we are doing a lot of the work. Originally, they didn't know that, okay, COVID, if you touch hard surfaces. And there was a lot of positional switch between wearing mask and not wearing mask. So a lot of us were already suffering from sort of flu of an unknown experience or new experience, even before the concept COVID now come in. And who knows how long COVID has been around anyway. So there was a time frame, there was a little lag phase between when there was a real COVID and then a declaration of a pandemic. So our attitude towards the whole thing was different, and you might have been exposed already. Those who are doing cleaning jobs, people wipe their mouth, they throw rubbish around. We are picking the rubbish. We are working as drivers. We are working in home care, and all our works. These are all frontline workers, but we did not know. We thought doctors were the only people doing the frontline work until they now came out to come and tell us, okay, this kind of job was frontline. We can sit down and begin to restrata and reclassify some of these things so all of us can know the value of what we are doing and so that we can actually benefit from unemployment. So now that we have ANWEP, I still come to tell you why I feel that being part of ANWEP initiative was good, because these are entrepreneurs. Now you can begin to work for yourself, or you can now actually employ people like you. You've been like them, you've suffered just like them, and more people are coming in. And with that, we can also begin to put ourselves in those people who are now coming in shoes, and we'll begin to help each other, and we'll build a stronger, prosperous community. So that entrepreneurship is very important because there is so much benefit with this entrepreneurial thing. It looks like a word that if we tell all of our people to spell it right now, it will be difficult to spell, but its benefits are important. All right, so I am very glad and very happy with what you're doing. And so basically that is, then we talk about housing. Accommodation is important. You do not have extra room. You have a brother who came in and you need to let them couch for a few days. And we care, we love, we are compassionate. And somebody get COVID, how did the person isolate? Now COVID puts us in a position where we can now leverage and negotiate for the term of housing and the kind of housing condition we have. If you go to a place and you rent a house, a friend sent me a notice that was given to her by a landlord or a landlady. He said, when you came here earlier, you were the only person that was here. Then your boyfriend came, and then you had one child. And after you had one child, you have your mother coming sometimes to help you clean up. I feel that you have outgrown the space, so you should move. Now, if you are here, and then your conditions, if your immigration status is taken care of, what does the state do about that kind of issues? That we need to know. There are policies that regards home ownership, and there were some benefits you can never get unless you are a homeowner. And the condition for home acquisition is also you are not discriminated against that one, but it's just to be informed. And so even if you are going in for housing, what kind of housing do you go in for? You want to buy a house, which form of housing is cheaper? Which one is more advantageous to you? It's not you alone having a big house and then just a first. So if you're having a single story building as compared to a duplex building, which one will bring more money into your pocket and you'll be more prosperous? Definitely a duplex. And you still have an extra space. Somebody can be there and be paying mortgage. You still have somebody paying the mortgage, and you have a space for your isolation. So some of these things we need to really begin to look at them. We should not be afraid of debt. There is nothing like debt. The whole world, the financial system is created on debt. We shouldn't be afraid on that. Nobody pay tax on debt, so we shouldn't be afraid on those conditions. So those are things we need. We should not be afraid of debt at all. Nobody will arrest you for owing a debt. That's what you need to know. Once you go through the right means and you acquire the money, you can always renegotiate the terms. That's why we need to begin to bring all the professionals under the same umbrella have financial lawyer, corporate lawyers come in and see what we need to do. If you are now going to be employed, for instance, there are a lot of things I did not know, and I'm learning a lot these days. You know, if Miss Ogeji today wants to get a job, she goes there and go for the interview, and they say they want to sign a contract. And Miss Ngoji say, oh, okay. Miss Ogeji say, okay. And then you just sign. You think you are benefiting by getting that good job, but it's not true. You are not benefiting. What if Miss Gray actually has a company that can employ you? Whether or not she's paying you does not matter, but she puts you on her company as you are her employee. That means you're not going to be paid, though. You'll be paying Miss Grace. Your salary comes straight to you. And what happens to your taxing system? It's also different. All right. All these are part of the employment. I'm not a consultant, but I am. The reason why I'm talking generally like this is because there is a difference between a caregiving, a health care, and a health cure. There's a difference between a care provider and a cure provider. There's a difference between healing and treating. So I no longer have to think about a patient as an individual. I need to think about, even if I'm thinking about a patient, I need to think holistically. I need to think about the biopsychosocial principle. What is biopsychosocial principle? That means this is a principle that the whole health community proposed in the 70s, but we don't use it, because if we use it, people will be too happy and will create a paradise. We don't want that. So we adopt a model that is biomedical principle. Biomedical is treatment-based, it's not healing-based. So biopsychosocial principle says that you have a patient, but whatever he's suffering is just a biological experience. That person is having a social environment he's coming from. If a person comes from a house and the person say, I cannot sleep, and I say, okay, I'm going to give you this melatonin, but the person lives by the roadside. His housing is just next to the roadside and plenty ambulances are passing there. How much melatonin do I need to prescribe for the person to fall asleep? Or you live in an environment there's a lot of gunshot. How happy would you be to sleep? How can you fall asleep? So I just say, okay, you cannot sleep, and I give you medication to sleep. Is that enough? So I need to think holistically. That's a social component of the biopsychosocial model. That's where, you know, the other component will now become like mental health, and then you have a S, which is a spiritual component, or the metaphysical component. So this is what I am beginning to really to share. I believe in the biopsychosocial principles. So this is the reason why I'm talking generally. All right. So I'm not digging too deep into any of them. If you have questions, you have my contact. Anybody can contact me anytime that you want. Housing, you need to know there's a lot of home ownership release funds. When it comes to health, there's a lot of issues about food, supplemental nutritional benefits that are there within the system. There are a lot of clinical trials that are going on where they can give you maybe up to $1,000 a week or $500 a week for you to do shopping, to eat a healthy food, to see if that affects, you know, there are a lot of things there in the system that if you do not talk to doctors, people who knows you, people who know you, they will tell you. Those who don't know you, they won't tell you. They'll tell their friends and family. They will not tell you. They'll tell people who look like them. They will not tell you. I was walking around recently, and then I said, let me take a bus. I take a bus, and I found out, oh, okay, there's a study within the facility that I had a friend working in. Oh, okay, we want to see whether or not eating healthy, fresh gross will be able, gross vegetables and things like that will help your blood pressure come down. And they will give you $500 every week, or they will buy the grocery and deliver it at your doorstep to see who wouldn't be healthy. Of course, you'll be healthy. These are some of the, and it is nationwide. It is nationwide programs. This is how we build a stronger community. So people benefit from a lot of, okay. You have a question?
Yes, we do. Definitely, this is so good. So I want to recognize Pastor Ali. Yes, Pastor Ali, go ahead. Pastor Ali. Okay, I'll read it out. He asked, how should we become a transforming agent in our communities? That's a very good question. Again, do you want me to repeat it, Doctor? You're mute. Unmute your mic.
You can unmute your mic and ask your question. And I believe I've brought everybody in. So feel free to unmute your mic.
Okay.
And ask your question.
All right, and Pastor Raleigh.
Yes, Dr. Bright, great. Thank you for being on today, and good talking with you and hearing the information that you shared with us. But I would ask you a very direct question on how can we, based on your experience in the communities of color, how can we become a change agent or transforming agent in our community to make things better?
Thank you very much, Mr. Pastor Riley has been very, very helpful. Was very kind when I was in Dallas few weeks ago, and through her we're able to connect. And I'm very glad to be here, Pastor Riley. I really I recognize your ministry, and I'm very glad for what the Lord is using you for. I think how can an individual become a transforming individual in our community? I think we all have to be like Pastor Riley. Yes. So to become a transformation, or to be an agent of change or positive change within our community, will require us to understand the state in which our community is, and what are the things that are there in other community that we envy that we do not have within our community. All right, and how can we contribute to the solution rather than reiterating the problems that exist within our community? So how? You say to become an agent of change, first of all, you need to identify one person who is an agent of change. Then number two, then you have to become one and you teach one. So identify a person who is a transformation agent. Now, if you identify that person, emulate, all right? Become like that person. So in the process of learning to be like that person, you also find somebody to teach that person to become an agent of change. But first of all, the community, so that's how you identify to become an agent of change. But how do you change the community? How should that contribute to the change? I mean, a change would be starting from a position and going to a destination. So a change is a change. When a change occurs, a society or a group of people are transformed from a state of probably inactivity, improductivity, to a productive and probably a significant improvement in that very society positively. That's what I believe in. So we need to first of all identify communities that our community need to emulate. Then we find out how did they get there. Then we need to find people who are making those things happen. And we can question, how did they make those things happen? How can we also, do they have a system that we can copy? Do we have, when the Chinese do not have anything to start with, they went to another country and see how the people were doing, and they copy everything. And then when they went back to their country, they continue copying until now they are creating their brands. And that's how you create a change within your community. Go, look, then whatever you have learned means you desire and you coveted it, become the instrument not to hold on to it, because change is a flowing river. It is called a river when it flows. It is a lake when it is stagnant. So an agent of change will be an individual that becomes a conduit through which things move through. So maybe in the future, we can have a lot of talk around the whole concept of how we can systematically bring change in each of these areas that I have talked about. And I will begin to look for people who think exactly like me in different fields, and I'll connect them to you, Ms. Ogeji, and then your group. If I know a lawyer in that very regard of immigration, I'm going to connect that person to you. If I know somebody who is in the housing sector and knows something about the United States Housing State Corporation, what are the policies there to benefit immigrant communities, I'm going to connect that person to you. Now, so that is on the housing side. So let me just finish the last aspect of the talk, then you can now continue to have all the questions. You know, education is it's one of the whole most important aspect of the pre-existing condition. We are among the very highly educated population within these very country. A lot of us, the Nigerians, are the most educated immigrant communities in the entire of the United States. The richest African diaspora community, the richest person comes from Nigeria. Great doctors come from that very space. I'm just trying to say that I'm using Nigeria as a point of excellence and as a reference of excellence. And so we have it all, we have everything. So we have this education. Now we are, what I'm talking about the education here is, there are instances where a certificate program in just the same field you've been working for many years, just a certificate program there that do not require so much of a hard labor, can actually change your status from what you are doing to what you can do and a position of power to do more. So there is America for the informed and the America for the uninformed. When you do things the same way, you become perfect at it. And if you actually know only how to do things the wrong way, you will become perfect at doing it the wrong way. If you know how to do things through suffering, you will become perfect at suffering. But if you know how to do things in a way that do not require suffering, but in intelligence, a more efficient way, you become an efficient and intelligent person. You know, so I must say that there are a lot of benefit within the areas that I mentioned in the area of health. And when we talk about health, you're talking about nutrition, disability, and all that. There's a lot of things there that we can benefit as a people. Immigration, there is a lot of issues around immigration that predispose our communities. Employment issues, housing, and education. This is aspect of conditions, social problems that exist that cast us in a space where we suffer. So if we are talking about the fact that COVID had taken the lead of the challenges we face as a community, these where these things fall under. And I must recommend strongly that your organization leadership connect with one gentleman by name, Mr. Emmanuel Irono. Mr. Emmanuel Irono is a leader of the TIS Foundation. You know, and TIS Foundation is around the Washington area, and he is doing a lot of amazing things, and he has access to a lot of inside information that would be much more beneficial to you than even what I am offering you. And I'm very glad to have known him. He's been a very positive and a strong forces that we have here as a Nigerian community and an African diaspora community. So, you know, when I send you my profile, I said that TIS Foundation.
Could you please put his information and the foundation name in the chat for us?
All right, the chat.
And thank you so much. You know, Pastor Riley's question is something that has been at the back of my mind. How can we become a transforming agent in our communities? And your response is very spot on. Each one reach one, each one teach one, right? So you have to see, connect to those communities that are doing work and making an impact in their own communities and try to emulate them. And you learn, you emulate, and then you try to implement, you try to be that agent of change. This question also came up I believe during our rally, the MLK rally in Dallas, and somebody asked, our people, we have all these talks and, our people don't show up, our people don't do this, and and there are community organizations that help us in sending those targeted messages. Even Miss Linda told me that, Ogechi, there is a department in the city of Dallas that their job is to send out mailings to, either immigrants or a particular group. They have all that information and they get it from either maybe immigration or, the census or whatever. These government agencies, they have that. So you can tap into that and make sure that your information is reaching your target population. I believe Carl from CCRC also said the same thing. He answered somebody, he goes, that's why we're here. I'm Community Resource Center. All we do is connect people to people. You need people, you need to connect people, even information. Information is very powerful. Some people, like Dr. Henne said earlier on, some people don't know what to ask. They don't know what is out there. So we have to do a better job of, making those critical connections so that we can start to leverage people that can give us the information that we need to create those better communities. Like Dr. Henne has given us one now, the TIS Foundation, from this community conversation. And that is why the work that ANWEP is doing is very critical, because these community conversations, this safe space where we're able to connect with people who look like us, professionals from all backgrounds. Dr. Henne is a medical doctor, a scientist, and we're able to bring him in this kind of community conversation. This is that agent of change. This is moving in that right direction, because we're having these conversations. He's telling us insider information that some of us didn't even know existed, and he's making a connection for us, to resources that can help us create those communities, those stronger, healthier, and more prosperous communities. So I thank everyone for being here. We love to keep our community conversations under 1 hour, but this is so interesting that, I just was like, wow, I'm gonna keep listening to get as much as I can out of this conversation. Thank you so much, Dr. Henne. We're going to have to be bugging you. We're probably going to invite you in person. ANWEP has like an annual conference and convention, and what we like to do sometime during our convention is to appreciate those that have contributed in one way or another to our organization, all right? And what we do is we recognize them and then give them a platform to share with the world what they are doing, and I would love to extend that invitation to you during our next convention. It's typically during the summertime, late summer, like August, so you'll be hearing from us. And if anybody else here has a question while we have Dr. Henne with us, please feel free to ask. Israel, you're very quiet. Do you have a question for Dr. Henne? Israel has, go ahead, Israel.
No, I just wanted to say it's been very enlightening listening to you. I'm very excited to be a part of this conversation. I mean, there's so many things that I've taken note of. I think the one question that comes to mind, we've talked about the physiology, the impact. We've talked about, being an agent in a community, to spur conversation that can lead us into, productivity, but the question that always comes to my mind is, what is the psychological impact of, COVID, to the rest of the world? As we build our lives, how has COVID really impacted us psychologically and impact the way we communicate with each other? Because, trust has gone down. and there's a lot of conversation about the vaccine that are positive or negative. I'm just wondering, how do we continue to push, using your platform, to push a positive message that is concise and effective as we talk to various members of our groups?
Yeah, so I'll just say a few words. Like, I know that we're far behind time. Could you imagine the impact of smile? When you smile at somebody, do you all feel good when somebody smile at you?
Of course.
Yes.
Whether or not you know the person or you do not know the person, when we draw the sun, we try to put a smile face on the sun. But what if you have a mask on? Can you see a smile? So
no.
Imagine a world without a smile for the past 4 years. How depressing that kind of world is.
That's good.
And come to think of the impact. Do you know the role of a growing child? And when children are born, the first formative years of a child, he cannot interpret what is what is activation and inhibiting process of emotions without smile. Imagine children without smile, seeing smile when they're growing for 4 years.
That is an awesome, precise, concise response.
Absolutely.
Because I was going to go in that direction of mental health, the impact of COVID on mental health. And Dr. Hene just summed it up with just this smile, analogy. Because I was going to say, the isolation caused due to COVID, the lack of socialization, it was just everything around the pandemic and everything that it came with didn't do anything other than mess up our mental health. You can't go out, you can't socialize. People, there was no trust. You're talking about trust. No, you don't even trust the people you're in the house with. Somebody goes out and comes in, you're like, oh my God, I don't know if I'm, somebody coughs, you jump through the window, So this is it, the mask. And what the COVID, as we push the message of the vaccines, the COVID vaccines, believe it or not, it has helped. At least when people are fully vaccinated and fully boosted, they don't have to wear the mask anymore. Now we can see smiles, right? So we have to continue with the message of our communities getting vaccinated. And one thing we've heard from the Department of Public Health, I believe in one of the counties here in Texas, is that I've not validated that statement. I still have to do that. But I was told that the summer of this year, COVID-19 vaccines will be commercialized. It's not going to be free anymore. So, and when that happens, guess who is going to be disproportionately impacted again? The underinsured and the uninsured. And it's community of color, particularly immigrants, that are going to suffer this most. So we have to try to push for this message to have people get those vaccines. There's a lot of hesitancy around COVID-19 vaccines. A lot of them stem from past, historical, systemic kind of discriminations or whatever in the healthcare system. The Tuskegee experiment was one of them. So people are not trusting of the government. They're not trusting to get the vaccines, and it's not helping. And that is why we're putting our face to this message so we can try to start to build trust, to rebuild trust, because when people see someone who looks like them telling them about these kinds of issues or encouraging them to get vaccinated, then they tend to, trust you better than just what they read in the papers. And moreover, our messaging is very targeted. Dr. Hene came in and, from the first sentence he made was how his grandmother raised him, around his upbringing in Africa. So we are connecting to our people in the language that they understand. You know, most of us Black people are Christians. A lot of people trust information that they get from, you know, their churches or their religious, outlets. So everything that we're working on is targeted towards creating communications and messaging in the way that our people want to understand it and absorb it and act on it.
Yeah, I'm sorry. This is what I say to people. There was a biblical story where somebody was at the bosom of Abraham. There was a man called Lazarus, and then there was a man who had a very good time on earth. And then he said he needed water to be dropped on his stand, and that should quench his thirst. And then they said it was not possible. And then he says that, okay, can you send somebody to my house to be able to tell them that, okay, getting a specific thing will prevent them from suffering from how I am suffering now. So this is what I tell people. Have you heard that somebody died of COVID-19 virus? They say, yes, okay. Do you see how they saw some of them were finding it difficult to breathe? They say, yes. So those who've gone through all the suffering and died, do you think at their point of death, if they told them there was something they could have done maybe a week earlier, that wouldn't make them go through the suffering they had gone through? Death is inevitable, but the agonizing death that they went through, would they have made the decision? Or if they give them the opportunity to come back to life, to do that specific thing so they will not die or have the suffering death, do you think those people will be willing to come? I'm sure they would come, just as that rich man was willing to really send people back home to tell his people that they needed A, B, C, D to be able to not have the same suffering. So
yes.
If I am going to make a decision now, and that decision is going to be as though I'm making that decision on behalf of the people that I love most that I lost, then I think I will do it. So that is how I try to make the narrative to people to see that you are not taking it for you, you're taking it on behalf of the dead. That, okay, if they were here and they told them they could live an extra day, or if they had had a vaccine, they wouldn't have died at the time they died, and they would do it, why wouldn't you, who is alive, who is having the opportunity, not take the vaccine?
That's right. That's right. That's, pretty solid, pretty powerful. That's right. And I know that story in the Bible very well. And we have a lot of pastors in the house. I know Pastor Johnny Riley is here in Israel. Thank you so much, everyone. We will continue this conversation. We will continue this work because, even beyond the pandemic, beyond this project, we need to have this kind of safe spaces for our people to connect and network and discuss issues that confront us, not just COVID, financial issues. You mentioned housing too. That's another beast altogether that, we need to have conversations around how we can help our people get into homes that, will help improve their lives. You talk about living where there's traffic, people having sleep issues, and then you're trying to put a Band-Aid on something, giving them medication, as opposed to, knowing where they are, meeting them where they are. Okay, can we do something to move you from this place so that you can be, get a house in a quiet area, quiet part of town, instead of, pumping you with sleep medication? Can we do something to solve the underlying problem? So, there's a lot of work to be done. There's a lot of work to be done. So we definitely need to continue these conversations even beyond COVID. Yeah. Thank you so much, everyone. Linda, do you want to wrap up?
Thank you.
Israel?
No, I wanted to say thank you to Dr. Bright. Thank you to Gochi. Thank you, Miss Linda Gray. Looking forward to meeting you in person because I met Gochi, and hopefully, meeting you one day, Dr. Bright. I do appreciate this conversation. It was quite enlightening. Thank you, everyone.
Thank you. Thank you for joining us. We appreciate you, appreciate everyone here that took the time off of their busy schedule to attend. Thank you. And the video, excuse me, the recording will be available on YouTube. So the link will be shared via email so that everybody can, you know, kind of forward it or share it with your contacts as well as other videos that we have on YouTube. All right, Miss Linda, sorry. I'm sorry.
Just want to say good evening to everyone. Thank you for attending this wonderful, impactful conversation. And thank you. Good night.
Good night,
everyone.
Good night,
Thank
everyone. Thank you, Dr. Henne. It's a great honor to have